I am Dr. Peter Bridge. I am the academic chair of the Medical Laboratory Sciences groups. That's 3 programs, including Medical Laboratory Science, Diagnostic Cytology, and Genetics Technology. So all 3 programs lead to graduates with the designation MLT. Genetics Technology and Diagnostic Cytology are advanced programs where there is specialist training. Diagnostic cytology traditionally has been looking down a microscope at cells to decide whether they are normal or potentially abnormal. And so many questions relating to the development or diagnosis of cancer would involve samples going to diagnostic cytology. More recently, the curriculum has expanded to include training in molecular diagnostics so that people graduating from the diagnostic cytology program can also run molecular diagnostic tests for things like human papillomavirus or HPV, which is one of the causative factors of cervical cancer. And so it's the complete package. They can look at both the cells to see if they look normal, as well as look at the potential infections that might trigger the pathway towards cancer development. So right now I am sitting in the microbiology lab, and one of the very important things that has enabled us to keep running during the COVID pandemic is in previous years we had 36 students in this lab. We've now divided it up so that these little yellow stickers on the bench tops indicate spacing suitable for maintaining at least the 2-meter distance between students. Everybody has their PPE, we have the face shield, the face mask, the lab coats, the gloves, and so we can continue with everything in normal safety. COVID actually has made almost no difference to the microbiology lab because the students last year and the year before looked just like this, fully protected. COVID is one infectious agent that everybody is aware of right now. But when we're teaching students how to work in a microbiology lab, they're handling pathogenic specimens all the time. And so they have microscopes to work with, there would be streaking plates, and the only difference that the COVID-19 has made is that we have increased the distance between individuals in the lab. So it's no longer crowded and busy, it is spaced out and busy.
Hi, I'm Gulrukh, and I'm a faculty member and Programs Communication Liaison for the Diagnostic Cytology program at the Michener Institute. Michener is the only school in Canada which offers a diagnostic cytology program. The graduates from this program are primarily responsible for evaluating samples under a microscope, and usually they're looking for something like cancer, precancerous changes. They may be looking for therapy effects and infections as well. The most common sample type that cytotechnologists actually deal with is a pap smear, which is a gynecologic sample. Some of the non-gynecologic samples have been shown an upward trend in the recent past, and these include some fine needle aspirates from thyroid, lymph nodes, and salivary gland, some body fluid samples such as urines and cerebrospinal fluids, and other respiratory samples as well. So you can tell that a cytotechnologist is required to sit on the microscope for long hours, and they need to demonstrate good problem solving and critical thinking skills. However, depending on where they work, they may also be required to get involved in the preparation of these samples. With the recent advances in the field of cytology, there has been an expansion in the scope of practice of a cytotechnologist. So now we have included the courses of molecular diagnostics and tissue preparation and assessment in the program as well. This expansion of the competency profile has actually increased the job prospects. Also, the concept that a cytotechnologist actually sits on the microscope all day does not hold true anymore. Some of our recent graduates have actually been hired at hospitals and private labs as hybrid technologists. That means they get to rotate between different disciplines. So during these unprecedented times, some of our recent graduates have actually contributed to COVID testing in hospitals and private labs. So the knowledge and experience they learned from their molecular diagnostic course has actually led them to extend their skills during the pandemic. Now, talking about the length and the mode of delivery of the program, the Diagnostic Cytology program is a full-time program which is run over 62 weeks in total. The first 2 semesters extend from September to April, which are 60% online. Though the online component, it allows some flexibility to the students, but at the same time, they're expected to commit to 35 to 40 hours of their weekly time towards the learning. After these 2 semesters, we have the simulated clinical semester, which is 12 weeks in duration, and the students are expected to be here Monday to Friday, 9 to 5. During the simulated clinical semester, students, they actually work towards their competency in a safe simulated environment before they are actually ready to enter the clinical. The clinical semester is actually 24 weeks in duration and is completed at a hospital or a private lab. We are lucky to have great clinical partners across the country, and they actually play an integral role in the success of our graduates. Diagnostic cytology is actually a very rewarding career. Being a Michener graduate myself, I can say that this institute prepares you more than a healthcare professional. We are actually lucky to be able to deliver the program safely during this pandemic, and this wouldn't have been possible without a solid strategic plan supported by scientific evidence and professional guidance. With the national shortage of medical laboratory technologists, I would say this is an excellent time to enter the profession. I would also like to say that if you are someone who is actually passionate about patient care, if you like to work in interprofessional teams and like to problem solve, this is the right program for you. I wish you all the best in your application process. So this is a set of glass slides, which are primarily the pap smear samples. You can see that these slides have dots on. That means they have already been pre-screened and have actually identified areas of interest on this slide. I'm going to start looking at the slide on 10 times objective. This is the lowest magnification that we usually screen the sample at. What I'm trying to look at on the low times objective is any patterns, any significant findings, or any red flags that should actually prompt me to go on high power to evaluate the cells or the groups further. So what I'm looking at here, for example, is a bunch of normal squamous cells that have been taken from the exocervix. They are quite the size what I expect them to be. The nuclei are quite monomorphic. The cytoplasm is exactly what I expect, like very semi-transparent type of cytoplasm. I would go down to the 10 times objective again and continue to look. As I find something which is suspicious, I will go back to the high power magnification, which is the 60 times objective here in my case. And I found a cell where the nuclear size is considerably larger than the ones that we had initially visualized. There's also a bit of clearing that has started to happen around the nucleus. So this is actually a coilocyte, which is a precancerous change that indicates the human papillomavirus infection in these squamous cells. This should actually make me go to other areas of the slide and look for better diagnostic cells. I will put my diagnosis on a piece of paper and then put my dots on the slide and let the pathologist confirm my findings by going back to the dots and evaluating the areas of interest. So just like we use the video scope for a class instruction or for a class tutorial, we use a double header unit for a one-to-one interaction. So for example, students, they find certain morphological findings and they want a confirmation on their findings. Both the instructor and the student can look down the microscope and the instructor can confirm their findings. They both are looking at the same thing, so we know that we are not talking criteria. but actually looking at the cells and describing the criteria at the same time. So this is a very useful tool that students really enjoy during their time at Michener. It is very helpful for us to describe criteria and to get students more comfortable in their diagnostic interpretations.